On April 3rd, the Philadelphia Tribune reported that African Americans were dying at a rate greater than anyone else. And that was my wake-up call to say, okay, I'm not just gonna sit on the couch, I need to do something. And I said, well, I have my own private practice. I have an account with a CLIA-approved lab to get these test kits. You know, my mom went and rented a van for me. I had PPE. I had a website where people could register for the test, and I did it, literally in 48 hours. 2 days later, we tested 150 people at Miller Memorial Baptist Church, and by April 20th, we were testing almost 400 people at Enon Tabernacle. My name is Dr. Ayla Stanford, and I am a wife and mom of 3 amazing kids and a pediatric surgeon and founder of the Black Doctors COVID-19 Consortium. In Philly, 44% of the population is African American and 52% were dying. And I wanted the people who were trying to get tested, African Americans that couldn't because they took a bus and they needed to be in a car, because they didn't have health insurance, because they couldn't have a scheduled appointment during 9 to 5 hours, because they didn't have a state-issued ID, because they had kids and if they went to a place, they didn't test children, because they didn't have comorbid conditions, because they weren't over 65, because they weren't healthcare workers, because they didn't travel to China. These were all the restrictions placed, and so it excluded a lot of African Americans. So what we did was we created this barrier-free testing for coronavirus. And all those reasons I mentioned, we did not have with our testing. So if you didn't have a doctor, it was okay. I was the doctor for 12,000 people from the city of Philadelphia. If you didn't have a referral, I was your referral. If you didn't have insurance, I assumed the cost until the CARES Act came out. I knew we were where we needed to be and we were doing exactly what we needed to do. I wanted the community to know that we as Black healthcare professionals value your life. We want you to have the same equity and the same access as everyone else. Evidence has shown that Black doctors, when they care for Black patients, those patients have better outcomes. And I wanted people to have a certain level of comfort because we didn't have an opportunity to build trust. I hoped that in the name, we would be giving some trust. This is Christian Stronghold Baptist Church, and there's actually half the team here, about 16 of us. And there's about another 16 of us 4 miles away at another church in West Philly. We've got people coming to get antibody tested, which is a serum blood test. We're doing the COVID test because the cases are going up. I want people to know their status, so if they have it, they can isolate, we can start the contact tracing, people can be quarantined, and it doesn't spread. Never went into it thinking I'd end up on CNN or BBC or NPR. I mean, that's like crazy to me. It's like, what? How does that happen? So I thank you for it, for recognizing what we're doing, the importance of what we're doing, and that we're not just changing lives, but we're saving lives out here. My hopes for the future, for the consortium especially, is that we can take the COVID-19 out of the title and we're Black Doctors Consortium. And what we offer is health advocacy in the way of office hours or a clinic for you to come get a second opinion, sort of like what great lawyers do when they do legal aid, that we can do it for communities that are underserved and often don't have access to some of those phenomenal doctors because their insurance doesn't cover it. And we're gonna keep going as long as the city of Philadelphia needs us, and even when they don't, because it's better to be preventive than be reactionary. And that's what we're trying to do in our consortium.